Our daily work often involves profound human experiences, such as birth, death, and suffering. These moments challenge us to make sound moral decisions. Understanding ethics and values in nursing ensures that we provide the best care while maintaining our professional integrity. As nurses, we are at the forefront of sensitive situations, advocating for patients and families during critical moments. For example, in the Philippines, nurses often provide care in settings where family involvement in decision making is paramount. This can differ from countries like the United States, where patients' autonomy is emphasized. These differences highlight the importance of understanding ethical principles to navigate such situations effectively. In today's healthcare environment, challenges such as cost containment and nursing shortages make ethical decision making more critical. For instance, in the Philippines, the shortage of nurses due to overseas migration often means working longer hours with limited resources. Similarly, in countries like the UK, nurses face pressure to balance high patient loads with maintaining quality care. These challenges test our values, making it vital to stay grounded on ethical principles. To address these challenges, we need to focus on these areas. We need to develop sensitivity to ethical dimensions of our practice. For example, we need to recognize our patients' dignity when resources are scarce. We also need to examine our personal and our clients' values. For example, we need to understand a family's preference for traditional medicine. We also need to understand how values influence decisions. This is crucial when facing dilemmas like allocating limited ICU beds. We also need to anticipate moral challenges. In international contexts, like in the Middle East, nurses often navigate cultural differences that influence patient care. By developing these skills, we can respond ethically and compassionately. Values are enduring beliefs or attitudes about what is important. They guide our decisions and actions, especially when we are facing ethical dilemmas. For example, a nurse in the Philippines might value family involvement in end-of-life care, reflecting cultural norms. In contrast, nurses in Western countries often prioritize patient autonomy. Recognizing these differences help us provide culturally appropriate care while upholding our professional values. Although related, beliefs and values and attitudes are distinct concepts. Beliefs are conclusions we accept as true. For instance, believing that regular health checkups prevent disease. Values reflect what we prioritize, such as valuing honesty when discussing a patient's prognosis. Attitudes are feelings or mental positions, like compassion toward a patient refusing treatment. In practice, these elements influence how we interact with our patients and make decisions. For example, a Filipino nurse might display a compassionate attitude toward a patient relying on herbal medicine due to cultural beliefs. Values are not innate. They are learned through observation and experience. In the Philippines, Filipino traditions often emphasize respect for elders and care for family members, which influences nursing values. Globally, values may vary. For instance, in Japan, harmony and community are highly valued, affecting healthcare interactions. Recognizing these sociocultural differences influences and allows us to respect diverse patient perspectives while maintaining professional standards. Nurses hold two main types of values. We have the personal values and the professional values. Personal values is shaped by our upbringing. For example, Filipino nurses often embody values like respect and empathy, rooted in family traditions. Professional values are learned through education and practice. These include altruism, autonomy, integrity, and human dignity. For instance, nurses in the Middle East often navigate complex family dynamics while upholding professional standards, such as patient confidentiality. There are core values that are guiding our ethical nursing practice. We have altruism. This is the concern for others. This is seen when nurses stay beyond shifts to care for patients during typhoons in the Philippines. We have autonomy, respecting patients' right to make decisions, like allowing a terminally ill patient to refuse aggressive treatment. Another one is human dignity. This is treating all patients with respect, regardless of socioeconomic status, whether it's in a rural Philippine clinic or an urban hospital in London. We also have integrity. We follow ethical standards like being honest about a patient's prognosis, even when it's difficult. Another value is social justice. It's advocating for fair treatments, such as pushing for access to vaccines for underserved communities. Values clarification helps us identify and evaluate our own values, promoting self-awareness and empathy. For example, understanding our stance on euthanasia helps us navigate end-of-life care. In the Philippines, where Catholic values are prevalent, nurses often align care with spiritual considerations. In contrast, secular countries may prioritize patient autonomy. Clarifying our values ensures our actions align with our professional standards. The values clarification process involves 3 steps. We have choosing, pricing, and acting. Choosing alternatives thoughtfully is the first step. For example, deciding whether to prioritize a patient's autonomy or family wishes in treatment decisions. Pricing means the choice by affirming its importance. For instance, valuing honesty in explaining a critical diagnosis. Another step is acting consistently. For example, continuing to advocate for a patient's rights despite opposition. This process ensures that our decisions are intentional and aligned with ethical principles. As nurses, we must reflect on our values related to life, health, and ethical issues. We can consider our stance on abortion or end-of-life care. Filipino nurses often are influenced by religious beliefs and may prioritize life preservation, while nurses in progressive countries may focus on patient choice. Reflecting reflecting on these values helps us navigate ethically challenges with integrity. Understanding clients' values is essential for patient-centered care. For example, a client may prioritize family input in medical decisions, while another client may prefer making independent choices. As nurses, we must explore these values through open communication and use them to guide care plans. In practice, we must respect diverse values without imposing our own. For example, a nurse in the Philippines may encounter a patient refusing modern treatment in favor of herbal remedies. In this case, respecting the patient's choice while providing education on safe practices is key. Globally, respecting values like gender-specific care in Middle Eastern countries is equally important. Communication is the bridge to understanding and integrating these values into care. To summarize, ethical nursing practice relies on understanding and respecting values, whether in the Philippines or abroad. Core nursing values like altruism, autonomy, and integrity guide us in providing compassionate, ethical care. As we face moral challenges, let us be encouraged to reflect on this question. What values will I uphold to inspire ethical nursing care in my practice?